Hi, everyone. AnneMarie Chiz here, your president and CEO. Welcome to AMC Connects Pilot Podcast, Episode 3. In today's podcast, we've got, I think, a great agenda for us. Number one, we will be going over some reminders around employee safety. Can't be more important to make sure all of us as a workforce remain safe so we can be available to our patients, our families, and the community. We do also have a great topic, very cool, especially coming off of the Pilot Podcast Episode 2, when we talked about the OBBA, the Big Beautiful Bill, and some of the impacts that we could be facing by way of headwinds. And one of the elements was, of course, from me to stay focused, stay calm, and making sure that we have open, accessible, great access to our patients in the community. But we've got an exciting topic to go over with a special guest that I'm just thrilled to be able to have this conversation with. So great deal of suspense for everybody. We'll be going over that and taking a deep dive. We will probably have a question from the mailbag, hopefully, that Chuck will take us through.
Mailbag!
As everybody might remember from episode 1 and 2, we do have a mailbag open, which is really important to me. I think Chuck and I underscored that there's got to be 3, everybody. There's got to be at least 3 with every episode. And I believe we have another 1 for this episode, but let's kick it up a notch. Chuck just told me that we had over 40 people watching the podcast, so let's keep it moving for sure. And then we'll close out our day, our time, with a little bit of fun that, of course, Chuck is taking us through, connecting with our colleagues and our team members across the network. So with that, stay tuned. With our agenda, wanted to talk about employee safety. I want to start by a great shout out for one of our teams off-site that noticed something within the parking lot, an individual that was taking pictures, spending some time in a parking lot on one of our off-sites, which is a really wonderful reminder that all of us as employees, if something feels off or looks off in any of our environments, it's so important to say something and do something. Incredibly important and to all of our safety, but really proud of these team members for noticing some odd behavior and elevating that to supervisors so that we could get some support over to that particular location. And it was a great trigger that Chuck was able to send out a notification that I am going to read to everybody because he did a great job articulating the reminder for us. And so this reminder that was sent out August 22nd, Dear Rome Health staff, we are committed to ensuring a safe and welcoming environment for everyone at Rome Health, including our dedicated staff, patients, and visitors. In light of a recent incident at one of our off-site parking lots, we want to remind everyone to remain vigilant and aware of their surroundings at all times. Recently, a staff member reported an individual taking photos and videos of employees in an off-site parking lot. Thanks to their quick action in notifying their director, the situation was promptly addressed and resolved. This incident underscores the importance of reporting anything unusual or concerning. If you observe anything that seems out of place or makes you feel uneasy, please inform your director immediately. Your attentiveness helps protect not only yourself, but also your colleagues, patients, and our visitors. Thank you for your continued commitment to keeping safety first at Rome Health. You know, many times we have policy violations. That's why we have policies to kind of guide our practice. We have scopes of care. We have standards of care. But so often it's our gut as team members across Rome Health that something just feels off. Whenever we have behaviors happening that might be outside of our standards, it's important, of course, to report. I think we all know that. But it's hard sometimes to identify when your gut is just off, because sometimes we convince ourselves that, oh, it's just us, maybe we're seeing things. But when in doubt, please make sure that you report. So a huge shout out to, again, these team members that were willing to stay close to a feeling, see something, and say something, and we could get some reminders out there. The world is a challenging place. Lots of different things have been happening, and it's really up to all of us to make sure that we keep each other safe by noticing things and reporting. So thank you again. As promised, also kind of at the top of our list, very excited, a quick reminder from episode 2. Again, we kind of went over when there's these headwinds, some people call them, or changes in healthcare, or I would say even massive challenges that healthcare has been facing for a number of years. It's important to stay focused, first and foremost, on our mission, vision, and values, and our core competency, which is delivering care to our patients and our community, and staying close to what it is that we do each and every day and being the best that we can be. But also part of addressing some of the challenges and changes in healthcare is being creative and innovative. And I'm so proud to say that here at Rome Health, it comes naturally. I think it's the grit this particular workforce has and how we're going to do whatever it takes to take care of our community. And creativity is kind of a core competency that I've seen amongst our workforce. Well, I'm pleased to be able to talk about a pretty innovative strategy or launch that the profession of nursing here, along with IT and a few others, have been thinking through, which is the topic of virtual nursing. And this is new in the profession of nursing. I think it's new across the state and even the nation. But what is virtual nursing and why are we bringing it to Rome Health? There was a little information that was sent off recently from our chief nursing officer. And as promised, we have a very special guest that's going to take us through a little bit more about virtual nursing in this episode. But I'll start with Rome Health was awarded the Mother Cabrini Grant, enabling the purchase of software, equipment, and staff to launch our new virtual nursing unit. So cool. This program is not replacing bedside nursing or changing nurse-to-patient ratios. Virtual nurses will work alongside bedside teams, leveraging technology to offload maybe non-clinical tasks and give frontline nurses more time to direct patient care. But really, what is this about? And so we've got the expert right here at the table on AMC Connects. And with that, I'm going to introduce our special guest and person, Sarah Dutch. Sarah, welcome to AMC Connects.
Thank you for having me.
Thank you for being with me and us.
Yes.
I think being able to talk about this important topic. But I have to say, I have been a Sarah Dutch fan since the first time I met you. Can we start with you sharing a little bit about yourself? And why Rome Health? Why are you here?
Well, let's see. I ended up at Rome Health because I like the community. Mm-hmm. I like being able to know everybody that I work with to an extent. So Rome really drew me to it for that reason. But also it's a very nurturing atmosphere, and that's kind of where it led me to here. I got the Nurse Innovator for 2023. So this really speaks to me, to come up with out-of-the-box ways to fix the staffing shortages and the ratios and things like that. So when this position became available, I jumped on it.
Nice. Yeah. Can I ask how did you become an out-of-the-box thinker?
Honestly, I have a history of veterinary medicine. So as a veterinary technician, I was also a practice manager. So, to solve a lot of issues, you've got to think out of the box. You've got to pivot and keep trying to figure out what works for your organization individually, because nothing is the same, So, yeah.
So do you see yourself as a leader, and have you been a leader for a long time?
I see myself as not so much a leader as an enabler, I guess, for lack of a better way of putting it. I just want to help everybody reach their potential to deliver really good care. And I'm very aware of, nursing shortages and things like that, and the requirements that we have to meet the standards that we want to keep.
Yeah.
But how do we think outside the box and fix that to work with us here in a way where it also lets the nurses have a work-life balance, in a way that provides patients with the education that they need instead of their nurse getting busy or getting pulled away.
Yeah.
So I think virtual nursing is a great opportunity to really hone in on our skills as nurses at the bedside and virtually to round out our care really well for patients.
Nice. So before we deep dive into that, you're a nurse.
Yes.
By background.
Yes.
Okay. Can you tell us a little bit about why you decided to become a nurse?
So I decided to become a nurse. It was funny, because like I said, I have a history of veterinary medicine. So I would constantly be making these connections with the owners of the pets, and eventually I just got to thinking, like, I want to move into the human side of things. I love the connections that I was making, and I wanted to use my skill set there.
Excellent. Okay, so let's jump into the topic of the hour, or the minutes, right, Chuck? we got minutes.
Oh, we got whenever you want.
Nice.
We can go as long as we want. It's a podcast.
Nice. So when many of us first heard virtual nurse, we were like, what? The profession of nursing is all about hands-on and touching patients and the healer's touch of a nurse and, focusing on the art and science. So tell us about what entails virtual nursing.
So a lot of virtual nursing is, much like you said in the beginning, it's leveraging technology to provide more space for the bedside nurse to provide direct care. Mm-hmm. So non-clinical tasks the virtual nurse can take over to help that bedside nurse from being bogged down. Mm-hmm. The virtual nurse can also help to be very available for a patient, where you're just popping into a room virtually to assess their needs immediately. So I think that will... I look forward to that helping patients and nurses.
Great. Great. So how did you hear about the position? How did you hear that Rome Health was embarking on this particular journny?
So I heard about the position because I was seeking to come back here.
Oh,
I wanted to find my home again, which was originally in maternity. Mm-hmm. Which I love maternity.
Yeah.
But after seeing this position that was posted, I just wanted to be able to be a part of problem solving.
Mm-hmm. Mm-hmm. And you saw the problem as related to one of your first statements, kind of the workload and
Correct.
The challenges with
Yep.
staffing. Okay, great. Now, I've heard and seen and been a part of that. We have a staffing committee here at Rome.
Yep.
Are you going to be part of that committee?
Absolutely. And before
Great.
I left for a little intermission, I was part of the staffing committee.
Mm-hmm.
I was actually a co-chair. Mm-hmm. So, yes, I'm very passionate about that.
Great.
And will be at the staffing committees.
So have you presented to the staff committee yet, and have you had a discussion with them?
I have not yet.
Okay.
But the next meeting is coming up soon here, I believe, so I'll be there.
Great, great. What can you tell us about what we should be aware of as an institution about virtual nursing? How can we help promote? Because this is, if we're honest, there's not a lot of institutions that
Right.
have virtual nursing, right? Do you by chance know how many do in our area?
Well, and the thing with virtual nursing is it's such a broad term. So when I try to look in the area to see who else has it, they are implementing it in all different ways. There's some that have it in the ICU, some that use it more for triage, So I think each organization is figuring out where it's going to work within it.
Nice.
So I'm prepared for a lot of pivoting.
Sure.
But I'm also
Smart.
prepared for as many suggestions as anybody will give me.
Mm-hmm. Mm-hmm.
Because I want this to be tailored
Excellent.
to our organization.
Do you have a starting point? So you mentioned that some people have started with triaging, some people have started with
Yes.
ICU. Do you have a focus area?
Discharges is where we're going to start.
Okay.
There's a couple models that you can adapt, but really it's just fluid. You can change it constantly. So one of the big asks that I have for people is to just send me an email with your ideas. I don't care if it's 3 o'clock in the morning. Send them
Great.
to me.
Great. When you focus on discharges, are in our first stage of launch, will we be answering call lights, you think?
I think that's where we eventually want to get with call bell triage.
Okay, great.
There's so much that we can do, so much to virtual nursing. So I'm trying to like hone in on one thing at a time because it's endless. So discharge is where we're going to start and get to like admissions and transfers.
Great.
And go from there.
Great. It sounds like the possibilities are endless.
They really are.
And you being open to that, I think, is just awesome, right? Yes. Now, the biggest fear I heard, and we talked about it a little bit, and I think institutions in the case studies that I've read, a few of them actually did some of this, which is replace bedside nurses. Where's your stance on that? And where are we thinking we're going to be with Rome?
So with Rome, it's a co-team type of approach. We're all a member of that team. It's not falling to one person, and it's to help to supplement and help to support bedside.
Great. Not replace.
Correct.
Awesome.
Yes.
Okay, great. And how many people do we have on our team?
Right now, it's me and it's Taylor Decker.
Great.
So we've got 2.
Congratulations again.
We hope to expand.
Yeah.
You know?
Congratulations again to you and to
you.
Taylor Decker. That's wonderful. Great. Shifting gears a little bit, Sarah, just because it's such a great opportunity to connect with you a little bit deeper. You're so busy. Life is busy. How do you think Rome Health can be as good as it can possibly be in the near future? You had mentioned that you really wanted to come back. You took some time away, got some experience other places, and knew it was time to come back.
Yes.
Maybe starting with what drew you back and how can we do more of that?
What drew me back is really the community of Rome, you know, of this hospital. You have such a great support system here, you know, many like-minded people. So really what drew me back has a lot to do with that, also with the innovation. I'm just impressed as a small hospital what we can accomplish and what we're doing. So that also drew me back.
That's great. Yeah, great answer. I have asked a few other guests this, so I'll put you on the spot as well. How can I be the best CEO for Rome Health I could possibly be? Like if you could wave a magic wand.
Just be open and keep pivoting, you know?
I love that.
Malleable.
I like that. Keep pivoting, like agility.
Yep.
You know, okay, great. Anything else? Anything else you want us to take away with virtual nursing? You want us to be patient, of course.
Yes, be patient.
I'm sure.
It's a lot to navigate. There's actually more companies than I thought there would be.
I've heard that.
It's a rapidly growing growing field, rapidly changing. So I guess one of my biggest takeaways is just ask me about it.
Oh, I love that.
You know,
Thank
ask
you.
me, tell me about what your thoughts are.
Yep.
You know, that it takes a village, right? So
That's right.
I'm here. My door is always open, and I'm open to so many suggestions.
Mm-hmm. Thank you, Sarah.
Thank you.
Okay, everybody, you heard it here first. Any questions that you have on virtual nursing, Sarah Dutch, our internal expert, she's working hard to make sure that she's maybe going to be, this is an AnneMarie thing, she's going to be the expert of all experts soon because she's here at Rome Health and, you know, really going to be a value add on our direct care clinical teams. Nursing, certainly, it's named virtual nursing, but I think it's going to have a wonderful impact, first and foremost for patients and their families. And again, you heard it here first. The focus is going to be on the discharge process. Thinking back to some of my primary nursing days, patient teaching was just something, Sarah, right? That it takes a lot of time and sometimes it gets caught up in the day of discharge or the hour before discharge or minutes before discharge. So being able to have a virtual nurse partner is so complimentary, I think, for that quality patient care.
Absolutely.
And I'm sure we're going to be watching some metrics, right?
Yes.
So
yes, we are.
Probably time.
We'll keep an eye on length of stay and discharge and admission too, you know, because everything's intertwined.
Yes.
So yes, we'll be keeping an eye on it.
Thank you for taking on this role. Thank you for coming back. It's just energy
Happy
giving.
to be here.
Yeah, great, great. Well, again, everybody, you heard it here first that Sarah Dutch's door is open, I bet virtually and actually. No pun intended. She is certainly on email, very responsive. I reached out to her to be a part of episode 3, and she got back to me very, very quickly, and also got back to me with wonderful information, a whole segment on virtual nursing and what an organization is doing to learn a little bit more about it. So stay engaged, stay informed on all these new pieces, and I think a wonderful example of taking a leap in being agile and thinking through some creative ways on how to take a step into the future, maybe before it's the norm. So really proud of Rome Health. A huge thanks to the Cabrini Foundation, and a tremendous thanks to Ashley Edwards, our Chief Nursing Officer, Michaela Turnbull and Cassie Winter and Stacy McDonald, I believe, for creating the roadmap to apply for the Cabrini grant. It was a sizable grant that is funding this particular project, both its capital side and employee side for support, which is, again, just wonderful. So very thankful to the Cabrini Foundation and the team that spent a lot of time on constructing that. Without further ado, Chuck, the mailbag is open. Let's get
Oh
a
boy,
question
ladies and
going.
gentlemen, here we go. The mailbag is in, and I'm opening it. There we go, I got it. So we got a question from Kim. Kim is asking, how does your leadership team stay connected to the real challenges your nurses and support staff face day to day? And what have you learned from them and that has changed how you approach retention? Good question, Kim.
Thank you, Kim. I think that might emerge, but Chuck will, and maybe because Sarah's still in the room, we'll ask them their opinion. What an important topic that may rise to the level of an actual podcast segment. So just as a reminder, people know a question or a concern or a topic, if it rises to the level of a point in the meeting that would be a topic for an episode, there'd be a special prize coming from Chuck.
Woohoo!
Yeah, great question. So the first part of the question is, how does the executive leadership team stay close to where it matters the most? I would say at the bedside, or supporting departments who support the bedside. And so I think there's a variety of formal patterns that we take, or paths. We have Thursday leader rounding, which we've tried to be able to construct. Not every department is on leader rounding yet as a scope, but trying to make sure that we are pivoting and adding new departments and rotating through, where it's a moment in time that we debrief before leader rounding and talk about some of the high priorities that are coming through the organization and talking about them. That happens on a weekly basis, like I said, on Thursday mornings. And we go out usually around the huddle boards to hear a bit about what's going well, what individual units' key performance indicators are, and then some barriers or challenges or escalations that people want to talk about. Then we actually debrief immediately after rounds. And we have a board that we talk through in terms of areas of focus that either can't be resolved right at the unit or department level and need more resources on them. Either resources in, by definition, more people on them because they're more complicated, or they've just been stuck for a long time. There's a variety of different examples on that. I think one that's top of mind for me is the dumbwaiter in the emergency department. I'm not really sure why it's named dumbwaiter. Does anybody in the room know that? But that's what we call it. And that's a huge source of challenges for timely patient care, our staff being able in our lab to receive specimens, and has added a layer of resources to make sure that we can keep up on our patient care flow. A shout out to our support services team who have kept an aged dumbwaiter going for a very long time. We're so thankful for them, but it's reached its end of life and we need a new one, and working with outside resources to try to get a vendor in here to get us a new resource. That has emerged as to one of the top priorities that our operations teams are working through. In fact, it's here in my office us on our escalation board in red because we don't yet have a vendor to come in and resolve that as quickly as possible. So that's one way. We certainly have our employee engagement survey that we talked about in episode 2. Really important pathway. So proud of our organization again for having a top participation rate in the country, and we're making some inroads there. I know some employees still feel like that, I participate in the survey and nothing ever changes. Well, for the 4 years I've been here, for the 3 survey cycles, it has impacted my priority list to improve the environment here at Rome Health, whether it was pay, benefit shifts, working directly with supervisors. I think 2 years ago, we had a lot of feedback regarding supervisory support, so department leaders and what they need to connect with all of us as a workforce differently. And so we've invested a lot of time into leader development. I would also say I get invited personally to employee meetings, and employee meetings have been incredibly beneficial for me to hear more about how the executive leadership team and directors are doing to make sure what's important to everybody in the workforce is equally, if not more important, to every part of the organization. So I share this a couple times in employee meetings, but you kind of see the CEO at the top of a pyramid, and then you have all these wonderful positions and people, and you have the base. And I would say, in response to the question, we would flip that upside down, and it's our workforce when we make those connections that really need to inform us, like virtual nursing, for example, that the workload is so high at times in clinical services as a whole, we need to think of new and creative ways through. Chuck, remind me of the second part of the question, because I don't know that I got the second part.
Second part was, what have you learned from them that has changed how you approach retention?
Oh, goodness. Retention. I would say what I learned from Rome Health almost 4 years ago is that workforce stability has to be the highest priority. I'll just say it directly from me. And I realized that in a variety of different ways, and that Rome Health had always had a strong, stable workforce. And due to the pandemic and several other factors in healthcare, a lot of that was incredibly challenging over the last several years. So workforce stability and hearing what's going to matter. I could have great ideas, but if they're not vetted and lined up with where all of you are, they're going to fall flat. And I've been really thankful that people have actually told me that this idea really isn't going to work and another idea would be better. Of course, there are some things that we have to do by way of conditions of participation and compliance and all of that. But largely, we write our ticket. Nobody comes in and runs our organization for us. It's all of us together. So retention is a top priority. And I would say still a major challenge. It's one of the reasons Chuck and I kicked this off, right, Chuck?
Absolutely.
Yeah, because feedback that I got was in the first episode, if you remember, or go back and watch it if you didn't see it, there was Carolyn and a few others that said, AnneMarie, you haven't connected with us on a large scale.
They miss
you. Yeah. Oh, I loved that. I said.
She's like, we miss you so much.
My heart squeezed. But when Carolyn dug a little deeper in that, or she opened up that conversation we did in the first episode a little further, is that all of you, or if not all, most people enjoy hearing about what's going on globally with the institution, and I need to communicate that effectively. So I'm going to continue to work on that. It was certainly the catalyst to the launch of the podcast. I know we're closing our time together, and we want to make it really efficient. I do want to close with some fall fun, like pumpkin spice and everything nice and all of those things. I'm not a great poet, but Chuck will make sure that we get to be able to see some of the fall fun from all of our employees. So take it away, Chuck.
Fall has always been my favorite season. I love the crisp, cool air, pumpkins.
I enjoy fall because I love drinking apple cider and going to apple orchards. Yeah.
I enjoy the fall because I like the color of the, hold on.
I love the leaves changing. I love going leaf peeping.
I like the fall because of the color change. How do I want to say it?
And all of the pumpkin spice, pumpkin pie.
I like when the leaves are changing in the fall because I like to take long drives. up north, and I love looking at all the leaves.
What I enjoy most about fall is apple picking and Kelly's apple pie cheesecake.
Everything about fall I absolutely love. I've already decorated for fall, so we're all set home.
I enjoy the scenery and the hot cocoa. I enjoy the apple picking and the fall season. Go Bills.
I can't use this.
The color of the leaves. How does this? Why am I like having such a problem processing it?
And pumpkin lattes, what I like best about fall, and the leaves changing and a little cooler weather where I can walk my basset hound puppy in the forest with the leaves. The colors, just everything. Everything about hoodies, campfires, everything.
You're a fall girl.
I am.
What I like most about fall is the leaves changing, baking, and looking forward to Thanksgiving.
I love the fall weather because of the pumpkin picking and apple pies, and I love going on hay rides and just enjoying the fall foliage. Foliage.
Wasn't that great? I mean,
Loved
really, yeah, Chuck, great job.
Some of these comments, though, I don't know. There's some Bills fans out there or something. I don't know what's going on with that, but we'll have to take care of that later.
I think there was a Go Bills. Chuck
Yeah.
Chuck does
That's
a great
wrong.
job. Thank you to all of you that participated. I do in the past, I've sent off those clips and those videos to stakeholders in the community, and they genuinely just really enjoy seeing us, seeing all of you. I think I shared that on one of the podcasts when Chuck and I were showing pictures of the parade, which was just wonderful. And I had a question and a statement from people in the community during my first years ago in the parade, and people are like, where are our nurses? Where is the patient access people that I get to see all the time? The community really enjoys seeing us and connecting with us. I do want to close with an important topic that is, a little bit heavy on my heart and on my shoulders. And I will kind of close with an inspiration. Kim asked the question, what kind of goes on at executive leader meetings? And one of the things we do or try to do is a reflection. And a few weeks ago, there was certainly some heaviness in the region in terms of people and challenges and how they've had outlets associated with those challenges. So this inspiration was just a good reminder, and then I'll have a reference. If today gets difficult, remember the smell of coffee, the way sunlight bounces off a window, the sound of your favorite person laugh, the feeling when a song you love comes on, the color of the sky at dusk, and that we are here to take care of each other. Sarah Dutch was kind of talking a little bit about this and our conversation and the nurturing environment that is Rome. And I would say, at the end of the day, if we have lived out our mission by sharing with each other compassion and insight and not just taken quick responses as the only thing that might be going on in people's lives, we've lived out our mission, vision, and values. In one of my most recent journals, the title of an article said, "The Quiet Power of 4 Small Words. How I Need Your Help Can Become a Bridge to Resilience and Shared Strength." I don't know that that's natural for healthcare and for healthcare people to say the words, "I need help," or "I need your help." And what this particular article was underscoring is that not only is that a good thing to do, but it can strengthen an organization's resilience. I know when I've done that, I do that on a regular basis lately. When we had one of the questions come in episode 2, healthcare is going through so much, one of my techniques is to certainly say, "I need help." But this article says the many benefits of belonging to Communities that we choose to join are self-evident, social connections, growth, learning opportunities, and at their best, emotional support. However, life often thrusts us into communities that we want no part of, including the community of the seriously ill. Medical challenges will impact us all. My family has been in and out of the scary, unpredictable, and stressful cancer community for the last few years. It recently gripped us again with vengeance. Anyone who has dealt with a serious medical condition and understands its wide-ranging impact on patients and their ecosystem, partners, children, siblings, parents, friends, co-workers, and neighbors, and how it wildly disrupts even the simplest of routines. What help really looks like in my professional career, I often shared a powerful lesson I learned early on, the power of the 4 magical words, I need your help. I owe my professional success in part to the small army of colleagues who responded immediately when I asked for their help. People are more connected and perform better when we feel that our work community cares about more than just our work output. Sarah, doesn't that seem like us?
It does.
Keep it up, everybody. Thank you for living out our mission, vision, and values here at Rome Health. When in doubt, with all the challenges, stay close to each other, ask each other how we're doing. Back to the beginning of the podcast, when something doesn't seem right, it's okay to lean in and ask, because that's consistent with our culture. Thanks for tuning in, everyone. My thanks to Sarah Dutch and Chuck, as always, for facilitating a great podcast. Enjoy the rest of your week, everyone. Thank you.